Urologist. Today we are demonstrating a new flexible ureteroscope from Biorad, which is 6.3 French, by name Sleeker. No conflicts of interest. Our aim is that whatever the new scopes come when we use, whether it is useful, in which conditions it is useful, what about the channel size, what about the vision, what about the fluid logistics, we will discuss in this live surgery. This case is actually the ureteric stone impacted with hydronephrosis. You can see left side hydroureteronephrosis up to the sacroiliac joint, and here is the stone region. Can you give the another x-ray where the stone is seen? So severe hydroureteronephrosis, mid-ureteric stone. Our aim is to do URSL. If the stone goes into the kidney, or if the stone is not reached by rigid ureteroscope, we will plan for this. Already we have chosen this case because stone has got migrated into the kidney. That's why we have chosen. But otherwise case is very easy case for URSL. When we were blasting, it has migrated up to here. Then I thought we can use this scope in this case. With this introduction, the first aspect is the scopes. I already told there is no conflict of interest. These two scopes are Biorad. We are not comparing with the other scope. Already Biorad scope is very much used in India. The major advantage is the durability. The durability of the scope is more, and it is reusable, flexible scope, even though sometimes people may call disposable, but most of us are reusing after good chemical sterilization, or even steroid sterilization also we are using. Now coming to the two scopes, when you look by the side like this, you will understand that the left side scope is bigger, right side scope is smaller. Sridhar, you hold the bigger scope, I will hold the smaller scope. There only you turn like this, turn no, opposite, yeah, like this, and both should be compared for turning. This is my heavily turned one is my hand. For example, heavily turned one is my hand. See, can you see here? And he is also turning. Now opposite side, when I am turning, opposite side I am better. This is the maximum turn. That's a maybe older scope, it is not bending, but this is a newer scope, 6.3 French, Sleeker by name. And this scope, all the things are same, except channel they are saying that it is 3 French. This is the first time I am listening that channel size is reduced. It's a disadvantage, but yes, if you wanted to do in a very small narrow ureters, non-stented, small volume stones, you can go with or without access sheath and finish the case. What is the smallest access sheath available? Do you know? Now 9 French normal sheath. 9 French fan sheath is also available. So 9 French if it goes okay, or else today we want to demonstrate a disc. For disc, this is disadvantage because 3 French. But for the laser fiber, this is not a disadvantage. You can go and powder and come out if you don't want to take disc. This is what you aspirate the contents. Normal RIRS is what? Just go inside, put water and finish top. Where does the water will come out? By the side of the ureter. Where it will go? Into the bladder. Will this small scope aid for that? Yes. Ideally access sheath, but without access sheath, smallest scope we are using. Now coming to the point without wasting time, here you can see the stone. Right in the upper ureter. Can you show in the C-arm where it is the stone, how it is migrated? Intact stone, severe hydronephrosis is there, and already we are emptying this stone. When we pass the guide wire, what size of the guide wire is ideal for passing the scope? Little thicker guide wire. Very thick guide wire is also a problem. Why? You know, Sridhar, why? Because the scope lumen is how much? 3.0. So when scope lumen is small, pass this Ramakrishna, please. This you pass it. This you pass it, and then this you pass it. Okay, you pass this. So he is passing into the ureter. What is the plan today? Plan today is the direct intrascope suction is not the plan. Sheathless RIRS. Whether this scope will go sheathless or not, we are. Now, do you require CM for this? No, because you have already seen the ureter. See the ureter here. This was the impacted site and it is gone up. Now, you can use this guide wire for passing the CM. Yeah. Now it has pushed up. Now can you give the scope? Now pass and I will give the scope. Biorad scope is through this. What is this called? Processor. Sorry. So he will attach to the processor. Same scope, processor is same because there is no need to change the processor. How he is attaching the processor? How he is switching on the light? Switch on the light. Yeah. Now he will change settings from the DVD1, SD1 to S video or SDI. So we have attached to SDI. Then the scope will come. Do we need white balance? In Biorad scope, we don't require white balance. It is auto white balance. Is it going to come? Yeah, it is going to come. See the vision. This is the first vision of a 6.3 French scope. Very beautifully gauge piece is seen. Now, is a tender scope. What we have to do is we have to pass over the channel. What is the channel size? I told 3 French. Where the guide wire is going easily, definitely will go. Do you have 150 micron fiber? Yes. Yes, already kept. So thulium fiber laser has advantage of 150 micron fiber. Now, flush water. Are you flushing water? No. So you have to use here. See, can you see the orifice? Can you see the orifice nicely? You can rotate like this. You can rotate like this. Doesn't make any difference. So is it going easily? Is it going easily? So I am not doing any rotation. Now it is not going. Guide wire, please. Guide wire is coiling below. Come down. If the guide wire coils, you got to pull to the guide wire. See, see the guide wire is coiling. So you come back, come back, come back, come back, come back, come back. Ideal, yeah, like that. That like you have to adjust. Now, can you put saline? You cannot put saline. So then we have to see the guide wire like this. Yeah. Now, what I feel is, can I go without guide wire? Now I have engaged in the, see, I am taking the scope into my hand. Can you show here? Without water, I am going. Can you see? But if water is there, the beauty of the vision will be there. We will attach. How to attach the water? See, he is passing the guide wire. Easily went into the ureter. This is not a stented ureter, na? This is a primary ureter. What is the future? Everybody is asking, sir, directly can we do primary RIRS? Isn't it? So, in the primary RIRS, when you wanted to do it, see water is going now. Now the beautiful vision is there. Vision is there or not? Yes. Now scope is going easily. How will you know? Entire lumen is looking adequate for the, is it looking adequate or not? In fact, you should go without the, is it looking without guide wire? But because it is first case, I don't want to use without guide wire. Now, whether it is in the ureter, can you remove the guide wire? Yes. Whether it is in the ureter or in the kidney, does it make any difference? No difference. But where will you be comfortable? Where will you be comfortable? Kidney. Now it has gone into kidney or not? Yeah. PUJ is slightly narrow or not? For that also this type of scope will be useful or not? Definitely will be useful. Now where is the stone? How will you know if you want to know very fast? See, PUJ is slightly narrow. No intervention done before? No. See, Now stone has gone into the kidney. Where it has gone? CM? Yeah, upper calyx. So it is good or not? It is good. Let us see where it has gone. Now putting water, is it safe or not? He is silent. Why are you silent? We don't know returns are there or not. But this size and lumen little bit narrow is there. Had it been, do you think that the fans will go into, this is the stone. Can you see that? Now it is in the wherever calyx, no problem. Now stone is seen. Without wasting time, can we start? Yeah, because the clots are formed. Are you flushing? Yeah. So if you are flushing, if the water is going, where will it go?
Come into the
Bladder. So if you put a feeding tube in the bladder, is it better? Better. You put the feeding tube 6 French and try to aspirate, so that we will see whether the water will come out or not. What is the most important thing, Ramakrishna? Water coming out, isn't it? Yeah. What is the size of this fiber? The fiber is 250 micron fiber. Now 150 micron fiber. Sorry. Now you flush little hard, Ramakrishna, no problem. Let us see. Right. Start now. What is the energy settings we want to keep?
Sir, 110, sir.
110. What is the mode?
Fragmentation.
Mode. So this small clot is obscuring, but no problem. We can push it and do it. Is it happening? Vision is same like other Biorad? Is good, nah?
Yes.
So we are doing sheathless RIRS, which is done by many people. You know, sheathless RIRS is done by many people in the world. Is it first time we are doing? No. But why we are demonstrating? Scope is small, 6.3. And these clots we cannot remove without fans. You know that? You can remove it like this. You can remove it like this. Flush Ramakrishna a little bit more. Yeah. Huh? But the problem is clot may be there all around. Okay, are you seeing it? If this clot is not there, it might have been better. But no problem. Every case will not be according to our wish and will. But vision is good now. Do you think that the bladder drainage is there? Anybody has put the feeding tube? Top lights on and show whether the feeding tube is there or not. Should I stop a minute? Yeah, I will stop a minute. You put the feeding tube. Yeah, he has put the feeding tube. Is this the advantage if the feeding tube can be put? Hold it, I will put it. Hold this, I will put it. Aspirate. Yeah. Now I will do the okay. Had it been not clot there, it might have been great. Anyway, we will not be pessimistic. We will nicely demonstrate. Even in the presence of the clot, we can do it. Huh?
In fact, not is
Anywhere. Are any water is coming? Huh? Okay, no problem. You are putting minimal? Very minimal. So, a primary stentless, sheathless RIRS we are showing. The otherwise it is not flush a little bit. Otherwise it is not new. I can put this in other calyx also, where you can put in this calyx. But it has become two pieces. Okay? No problem. People will also appreciate the frankness that the scope is working very well. Vision is good irrespective of this thing. So we can finish completely powder we can do. If this has pressure monitor, it will be nice.
Future maybe, sir.
Future maybe, yes. Ramakrishna, can you give, we will show one basket also whether it goes or not.
Yes.
That also we will show. Can we aspirate, Sridhar? Can we do aspiration? Whether aspiration will happen or not, will you show? You please show here. Aspiration in this 3 French channel. Aspiration. Yes. Yes. See, he is aspiring. See. Are you aspiring or pushing? Aspiration. See, aspiration is doing, water is coming. So this is a part of the disc also. Can you give the basket now? See, everything is important. This basket is what size? Encircle 2.2. Will it go easily in this? Yes, it is going through the scope. So what does it mean? Yeah. Withdraw. Yeah, like that. It is going? Going. So now what is my intention? Intention is to remove the clot and make this powder. Now flush, Ramakrishna, don't worry about flushing. Water logistics are okay. Yes. Open. Sheathless, yes. I know that. Leave it. I will not remove the clot. It is sheathless, I know. I am only planning. Okay. Okay. Are you flushing at least? Yeah. Yeah. Do it. Because flushing also, whether it will happen or not, we have to see now. Leave it. Okay. Now, can you remove this clot from that? Yes. 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 Again. So maneuverable. Yes. Sticky it is, no? Yeah. Yes, leave it. I don't want to come out. I want to give a idea whether clot can. Yeah. Yes. Whether clot can be dislodged or not. Leave it. Should I proceed without clot removal? Huh? Yeah. Try once again. Because if I empty this, it will be nice. Take the stone also, no problem. Stone removal is also better now. Yeah, Sridhar, you are manipulating too roughly. No, you are in hurry to do that. Water pressure is okay, Ramashna? Slow, you should do slowly, like that. Okay? Can I keep here? Leave it. Okay. It's a small stone. Okay, leave slowly, Sridhar. Yes, it is left. Now give me the laser fiber. Okay?
Sir, we have also made 9 by 11.
So 9 by 11 French access sheath is also there. Primarily we are showing the disc. Our job is done. Patient will not have any problem. We can.
We have 2 lengths, 35 and 38.
Yeah, 35. No, 35. No. 55, I think. Yeah, now I am doing very fast. I wanted to demonstrate that. Now I will do powder. Vision is good means what? Vision is good means what? Returns are also? Returns are also? Good. Okay. This popcorn here. The popcorn. Okay, can you aspirate, Sridhar? We wanted to aspirate and see. Aspirate. Yes, it is aspirating.
Yes.
Huh?
Yes.
The water coming? Yes, very good. Very good. Aspirate as much as possible. Let us empty it. After that, we will put the access sheath, fan's access sheath, and remove these clots also. Is it okay, Ramshna? This is a demonstration of a scope in all perspectives. You agree? Yeah. Now you flush, Ramshna. You flush. Yes, see, very small fragments are. This is true disc. Okay? You agree? Huh? Only this clot is hampering the vision. You agree? Yeah, that is also finished. Now you aspirate again, show. That means 3 French also you can do this. Huh? If the clot is not there, it might have been little better. But we could do it within 10 minutes. And now what I will do, same scope, 9 French you have, access sheet. Yeah. Now I wanted to put a guide wire. What is the guide wire? Same guide wire. What size? 0.025. Show that access sheet which is she is opening. What is the size guide wire? What is the size of the? 9 French. Okay. So 9 French access sheet. Now even Biorad is producing. We will insert that and suck this fragment. Whether this scope will do the job or not, we will see. What do you say? So far any damage to the scope? Can you see here? This is very narrow. Can you see? So whether I can pass or not, I have to see. Isn't it?
Yes.
Now I am coming out without any damage to the ureter. But is it necessary to do anything now? Ideally, no. But just out of curiosity, gently with my experience, I am passing. But you should be careful when this is passed because this is 9 French. So is the guide wire has gone into the kidney? Stay there. This is the only time I am using the C-arm. Otherwise C-arm is not necessary. Ureteroscope I have done without C-arm. Like your flexible ureteroscope is extension of C-arm. C-arm. Yeah. C-arm. 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 Okay. C-arm. C-arm. So it is not going. So our procedure is useful or not? Very useful. This patient we have done RIRS without sheath. After the RIRS also it is not going. PUJ was also narrowing. So purpose is served. Now if you put stent, what will happen? Those fragments anyway will come out. We have seen that. But our wish is to remove that clot, but not necessary. Do you agree?
Yes.
Now it is not going, don't push it. Okay? See, it's not going, don't push it. What do you say, Ramshna? Now what will I do? I go with the scope and put RGP and see. Is it necessary? No need. So what you wanted to see? Put the stent and come out. How will you put the stent over the ureteroscope? So now I will remove the guide wire. I will take the ureteroscope and put the stent. So work is done. Stone is fragmented. That's in a small stone, ideal case. So if this scope is not available today, you cannot do sometimes RIRS. That is the primary RIRS. So the primary RIRS for a small stone, these type of scopes are very useful. Now because we have done on the left side. See any damage here? Any damage? It can't do damage. See any damage here? Beautifully lined ureter. So the other side of the coin is we are saying you use the access sheath in post-stented cases in large volume stone. We are using, see now this was the area where stone was impacted and this is the area where we are going in the curved part. all these negotiations were easily possible. This is the area where all the powder is there, and this is the area where PUJ is there. I don't want to go beyond that. See, already powder has come into the ureter. So why you need to go with this, pass a 3.5 French. Why 3.5 French? You passed 6.2. See, it is going easily.
Yes.
Is going easily. Now what I will do? I will take out. Use guide wire as the pusher. And then come out safely. So how much time it took? Hardly. Forceps not necessary. You can do like this also. You push like this. See? Okay. It is a curve, natural curve, na? Like that. Now this female patient. Now that coiling is there. So to conclude, if you are doing upper ureteric stone, small stone, if you break it, if it goes into kidney, if it is a large upper ureteric stone, if it goes into kidney, if there is small stones in the kidney, you like to do RIRS. Any doubt? No. When you do RIRS, primary limitation is what? Whether the scope will go into the ureter. 90% of the urologists do RIRS with what? Sheath. Why? Water outflowists are good. So when you put the sheath, what is the minimum size? 9/11. Today, did it go at the end of the procedure? No. So if you have tried in the beginning, did it go? No. It might have not gone. Then what I did, I passed over the guide wire. How it went? Easily. Where you have reached? Upper calyx. Where the stone was? Upper calyx. What I have done, because clot is not there, I have done little bit of time. After that chunk of the stone I have put in the other calyx for vision, not for anything else. And powdered in how many minutes? 2-3 minutes. I tried to aspirate, is the fluid came out? Yes. That means if clot is not there, if the vision is very good, we might have aspirated all the dust also. So where it is useful, if the ureter is tight, if the stone volume is small, if you wanted to do primary RIRS, this scope will be useful. Your armamentarium will increase. You will have 7.5, you have 6.5, you will have access sheath. Whatever you use it, if the patient is done only stenting in this patient, he will be slightly unhappy, na? Unhappy for a small stone. I was doing pneumatic lithotripsy, it is going up. Why it is going up? Because hydrouretronephrosis severe. You can see severe hydronephrosis. In fact, one of the, can you see there? It is naturally, it will go up. Any time stone can go up. That is the conclusion. So we should appreciate the technology, especially if it is coming at the lower cost, if it is made in India, if it is available to everybody in the future, you should appreciate. Whether this will help or not, it is all depends on the clinical condition. But the scope at smaller size is available. But this is the only scope which has small lumen. But our encircle basket has gone. Our the 150 micron fiber or 200 micron fiber also will go. You can finish in 10 minutes and come out of the job. That's what everybody is doing. Sheath is a boost because water will come out. Here we will see whether this patient will have any problem. Unlikely she will have, because when he is flushing, vision was good. When he is flushing, he did not feel pressure. He is very senior. If it is a distended system, by the time you will clearly understand. I hope you understand. So smaller scopes have future. I believe in it. In future, smaller scopes have future. Smaller sheaths have future. Smaller laser fibers have future. Efficient laser fibers are future. Outflow also can be brought in a small ureters also. So sheathless RIRS versus sheath RIRS, disc versus fans, small scope versus a normal scope. The discussion will go on. Thank you very much for the opportunity.